So technology has held the promise for transforming healthcare, but yet we have not seen it happen. Our fundamental experience with healthcare has remained the same. We call up to fix an appointment with the doctor, we go to the hospital, wait in the waiting room, and then when the specialists come, they are themselves very, very busy. But still, by the time we see them for 10-15 minutes and come back, 3 to 4 hours have elapsed. And where the new smartphones and apps have made a little bit of a difference is where we are talking as a patient to an anonymous doctor. And when that happens, the kind of issues you're dealing with them gets reduced to fundamentally minor ailments, nothing major. So in this context, we met with this mindset, I would say we met Prasad and Ashu, who came to us with the idea of mfine. And they had a very fundamental insight. And the insight was that the patients today do have trust, and the trust is with the hospitals, where there are specialists, where they have gone and met the physicians, where there are specialties and various devices available. And how do you take that trust and extend it to the patient in a way which is not location dependent? So that was a hospital first approach which mfine took. And not only do that, but provide not just one specialty, just OPD, but all the different specialties which are available at the hospital, so that the entire hospital as a center is as if available on the cloud. And finally, use technology and bring best in class protocols from across the globe and make it available, so that when you're actually going through a pediatric case, the pediatric protocols which are being used are the best in the industry across the globe. And then you're actually able to provide not only healthcare, trusted healthcare, anytime, anywhere, but actually improving healthcare delivery itself. And they really liked this thesis. And it became even more compelling when we talked and heard some of the stories from patients who are using mfine. We heard stories like a working mother who is back home after a full day of work at 7 o'clock when her child is sick. And at that point, her option normally would be to go see a specialist in the city and come back at 7 p.m., where they might not even be available. But instead, within 60 seconds on mfine, she's in touch with the doctor, gets the diagnosis, gets the prescription, and the entire process is finished in 15 minutes, and she's back to doing what she can do and to work the next day. So we are really excited about the prospect and the potential of mfine to finally use technology to transform healthcare. And this fits in very well with Prime's own portfolio and how we think about our investments. Ashu and Prasad are very seasoned entrepreneurs with deep passion about fixing this problem. And here, technology is being used at a very fundamental and core level to solve a large problem. And this makes it a perfect fit for Prime's portfolio.